Okay guys, here's my video rebuttal to Jeannie's con argument in value-based medicine. So, value. Let's talk about value. What is it? Well, value's good, inherently good. Everybody likes a good value. In this country we've got things like true value and great value, or brands and names of stores. And now there's a siren going outside. So, everybody wants value. So I'm not understanding why Jeannie says the value is bad. How does it relate to medicine though? Let's talk about that. So in medicine we've got providers. And providers come in a couple of flavors, good and bad. So good providers are offering things like screenings, and they're doing this at appropriate times in people's lives that are going to give them the maximum benefit. And they're also, they're treating everyone as if they're family. They're treating sick people, young people, dying people, old people, everyone, and they're treating them as they would treat their own sibling or their parent. They're not seeing them as a dollar sign. So this is important. And then we've got good providers are doing diagnostics and appropriate diagnoses. If somebody comes in, they're complaining of joint pain, and they give them the right diagnosis of osteoarthritis versus rheumatoid arthritis. These are huge differences and huge financial drains on the system. So if they can give them the right diagnosis early, that's going to prevent them from coming back later and increasing the value of the system. In addition to the correct diagnoses, they're not going overboard with diagnostics like imaging. So everybody who comes in with shoulder pain gets an MRI. No, that's bad medicine. That costs a lot. That decreases the value of medicine. So they're doing appropriate imaging, appropriate labs, everything they're doing, appropriately, adding value. And then it comes down to treatment. Are they treating them right? Is this guy going to be treated for his osteoarthritis correctly, or is he going to be treated for rheumatoid arthritis when he has osteoarthritis? These kind of the side effects that goes along with these kind of things. All of this adds to the overall package of value. So they're doing it correct, and this adds hugely to the picture that we're looking at. Is somebody being treated for pain management correctly? Is somebody getting antibiotics when they need them, not just thrown out as candy? So the bad guys down here, nobody wants bad guys. Bad guys are offering screenings at inappropriate times. So they're still doing them, maybe. They're not having the PSA talk when they need to with their patients. They're doing colonoscopies and mammograms at inappropriate times, or not following the correct recommendations. Just things in general, let's check everyone that's over 50 for their PSA. No, that's not the guideline. That's awful medicine. You need to be having these conversations with your patients to discuss if that's something they want to go down. And then we're looking at treatment and diagnostics. So are they getting let's start with diagnostics. Are they getting the right diagnosis? Again, with the osteoarthritis versus the rheumatoid arthritis, are they getting, I guess we'll go to treatment. Are they getting the DMARDs versus opiates? Somebody comes in with what's obvious as RA and they get treated with opiates. How's that helping anybody? They need to be given a DMARD so they can control the progression of this awful disease that they now have. And again, with the diagnosis, they're getting it wrong. They're bringing these people back over and over and over. And that's not only is it inappropriate, it decreases the value on the system. They're throwing out antibiotics to everyone. You kidding me? You got a sore throat, you get antibiotics? That's not the way it works. The vast majority of sore throats are caused by viral, so why give out these? It doesn't make any sense. And certainly, you don't want to be giving out opiates to everyone and their neighbors in the neighborhood, because then you get the reputation as a candy man, and nobody wants that. So why are we even talking about this? What does this have anything to do with you? So what? What are we talking about, and how does it affect you? Well, we've got two payers here. We've got the Medicaid, which Jeannie already talked about, and we've got Medicare, which she also talked about. And the interesting thing here is we've got the good guys and the bad guys. So right now, they're being paid equally. These guys get paid for Medicaid, and these guys get paid for Medicare, and you know, these guys get Medicaid and Medicare, these guys get Medicaid and Medicare equally. But how is that fair? That's not fair. It's not fair at all. And the reason is, these guys are in it for themselves. It pays for them to get a bad diagnosis, because why? In the long run, you make an incorrect diagnosis, your patient's coming back. You give the wrong treatment, patient's coming back. Give the wrong medicine, patient's coming back. Inappropriate medicine, whatever. You know, this guy actually needed a CT scan when you didn't offer him one. This guy actually needed methotrexate and you didn't offer it to him, you gave him opiates. And this guy needed antibiotics, or didn't need antibiotics, and you gave it to him anyway, and now he has C. diff colitis. Great. Good going, bad guy. Whereas this guy, so all of these crazy things are increasing the bottom dollar payout from Uncle Sam, which we can get to. But all of these, all three of them, increase this bottom dollar, which is the payout. And that's inappropriate. These guys, however, are saving money. Big dollar signs over here, because they're saving money. They're the good guys. So why is it fair? Why is it fair that he gets the same amount of payout that these guys do when he's doing the prevention? You know, that's how he's saving money. He's saving money by decreasing recurrent visits. He's losing money by increasing return visits. Return visits. So, as you can see, it's in his best interest to give a bad diagnosis, because it keeps people coming back over and over and over to come in. Every time they walk in the door, they're paying a copay. Every time they walk in the door, he's getting an insurance payment. And that is bad medicine. So, let's see. We need to hit the bad providers where it counts. We need to hit them with their most prized possession, the thing that is tied to their ego. We need to take what is very big and make it very small. And I'm not talking about their penis here. I'm talking about their paycheck. We need to make their paycheck very small. When we need to make the good guys, their paychecks are getting very big. And the more lines through your dollar sign means the bigger the paycheck. So we need, as soon as these guys see that these guys are actually getting a much bigger paycheck, they're going to have envy. Again, not penis envy, but paycheck envy. And they're going to, before you know it, man, they are going to build a ladder. And they're going to climb straight up this ladder and go from bad providers to good providers, which is what they ultimately want, which is better for the system. Because like Jeannie said, we've got computers, and the computer says we've got Joe Schmo and Fat Matt, and we've got, who else? Billy Bob. And it says we're all bad providers, so decrease their pay. But at the same time, the same computer is saying, you know, we've got the Colombian Tiger, we've got Claire the Bear, and we've got Lars Bars, who are all good providers, so let's increase their pay. And who doesn't want an increase in pay? Because, let's face it, we all want the pool, we all want the nice lifestyle. So we follow this algorithm that is spit out by the computer, and we can see who's being a bad provider, who's being a good provider, and who is increasing value to the system. And obvious, the good providers are increasing value. So we can talk about, you know, we can draw our nation up here, and you know, this is the ugliest nation you've ever seen, but we've got fat people here and a little bit here and there, and we're all doing drugs and alcohol and smoking. and doing the McDonald's, but that's not the problem. And it's certainly not anything we can fix. That's a losing battle. Screw this. We're not even going to talk about that. Don't even think about that. We can fix the problem over here, because the problem lies in this awful triangle here between Uncle Sam and the bad providers. So soon as we can fix what's going on with the payouts between Uncle Sam to the bad providers, we can start to fix the problem. And that's when we increase overall value of our system. And who doesn't like value? We need value-based medicine. This is what is going to change medicine. So that's my 10-minute rebuttal. Hopefully it won't be that long, but we'll see.